Hi, welcome to Mad Medicine with Miss P. A couple quick things. I always watch these back and realize things that I forgot to mention, like in that ridiculous anesthesia thing. I forgot to mention that one of the nurses was the one that walked by and noticed the patient's eyes flickering. And then she told the anesthesiologist, who wasn't paying attention to his patient at all. And like, despite, I'm assuming, the multiple monitors on him, pulse ox, the CO2 exchange, the blood pressure, his heart rate, none of those, I guess, responded when he was, feeling everything and seeing these things despite his eyes being taped. Anyway, so it's not until I look back and think of all the things I wanted to say, and there's a couple other things I forgot, but I had to change the lighting today because otherwise I'd look goth, like pasty white with black lipstick. It's not, it's maroon and it matches really well. It just looks weird on camera. Like last week, the whole outfit matched really weird. Why my eyes look pink? Why my eyeshadow looks pink? I don't know, but it's in real normal light. It all matches, I swear. Have we met? Yeah, that's how I roll. I match. Anyway, I know there's a couple other little things I wanted to mention from watching previous things of things that patients have said. But I can't remember, and I always swear I'm gonna write it down, but then I forget, and it's not that important. It's just for entertainment. All of this is for entertainment value at this point. Not that there's not lessons to be learned. Oh, yes, I did want to read. Gosh darn it, it's on my phone, so I can't like read it to you. But a student sent me a really good one. Obviously, she's watching these, and she has a really good one. So she's now a previous student who's now been a nurse for years. She has her own student. I guess, at some point there was a student with her, and she sends me the student's charting. This nurse does like 20 to 30 or 40 assessments a week in her long-term care facility. So they had this patient in there that was more of a hospice patient, but, was getting ready to maybe be transferred someplace but, meanwhile, they're taking care of her. So because she's, more or less a hospice patient and, she's not going to be around for long, this student wrote something like, and I should have written it down to read to you. So the nurse tells me that she's like, we better rewrite your charting before you hand this in. So she wrote like, patient continues to die and blood pressure is dropping and dropping and dropping, but the nurse will recheck it later. No. Patient continues to die. Now, she's not wrong. You know what? She's not wrong. But that's not how we chart. That's not, you can't say stuff like that. Yeah, she's continuing to die. Will you stop dying already? She just keeps on dying. Damn, she just won't stop dying. And her blood pressure is dropping and dropping and dropping. That's probably a little hypotensive shock she's going into. You can't say that. You can't chart that. That's not okay. We know what's happening, but you can't chart that. So I'm thinking my students, after being nurses for a couple of years, they're really starting to get it. One of my favorite things that ever happened in an IV therapy course where I could really like rant and rave and tell you everything, honestly, 100%, because it's just us. We're not taking care of patients. We're not on the floor. We're not around other professionals that could overhear anything, so I can just be as honest as possible. And, I'm just kind of ranting and raving. And one of the students, I think I maybe even said this in a previous video, it's just one of my favorites. He kind of raises his hand and he's like, Miss P, you ever thought about maybe taking a break from nursing for a while? Because to him, I was just like, patience. But the reason you can do that is you can vent to others and you can go up because you're not doing it to the patient. You're always taking care of that patient, 100% being there no matter what. And the patients that I have almost, lost it with or really wanted to choke, or I felt like I wasn't being able to, wear my game face or hold out. Those were the ones, I'm not even kidding. Hey, and comment if this has happened to you. The ones that you're really like, okay, I'm going to get called into the office. Like I'm losing my patience with and I shouldn't have said this, or maybe I shouldn't have said it with that tone or whatever. Those are the patients that after the whole scenario is over, they're like, thank you so much. You've been so nice. What was your name? And I'm like, really? Have I hidden the crazy so well that you literally couldn't feel that I thought about throat punching you? Like that's how well I hid the crazy. And that's how good you get. You do. And I think like internally when you feel like you're being mean and evil or rude or, short-tempered, you overcompensate. So you're actually nicer and you don't even realize it. And when it's all over and they thank me, then of course I feel awful for even thinking, that I wanted to choke them a little bit, but patients are trying. No nurse out there is not going to say that it is not difficult taking care of other people. Anybody in a people business, a person to person business where you're dealing with the population. It is very, very difficult. So I think these nurses are starting to get that, and I'm just enjoying every minute of it. And I've told them, I tell them every IV therapy course, I'm like, when you go out and you get this stuff, text back to me. I will add it to the book. I'll write it down, and I really should write it down because otherwise I'm going to forget. But it's really good stuff. So it wasn't, but God, I want to say maybe a year and a half later, maybe even not that long. I can't really remember. I run into this student who's now a nurse, who's been a nurse, like I said, a year and a half, couple years later, who's been a nurse for a while. And he's like, and he's got like 5 kids. His wife was with him. I think they were visiting somebody in the long-term care facility I was in. And he's like, I can't take it. I can't believe, how crazy and how dumb people are. I'm like, yeah, I know. You've been doing what for a year and a half? Yeah, I'm working on 30 years over here. So yeah, that's a lot of built up. No way she just said that, or no way he just did that. And about a year and a half is as much as he could take. Sweet guy, I'm sure he doesn't, he hides the crazy too, but it doesn't take long before these people can really get to you. And that's why I miss my students so much, because this is, you can't make this stuff up. And while patients say ridiculous things that's very entertaining, they sometimes say it mean or nasty and or very matter-of-factly. Not that I haven't had a student tell me matter-of-factly stuff. And I told you this, my favorite one is the mastectomy shunt. That was my favorite one. If you haven't seen that, look back in other videos. It's there. It's fabulous. Okay, so starting here, since I've already wasted a good 6 minutes rattling on. Okay, I got, I'm assuming this was probably from a nursing care plan. Monitor blood Q4 hours. Are we drawing blood every 4 hours? We're checking it with a ultrasound? Is it a pressure thing? Is it an amount? Should we drain it every 4 hours and put it back? I don't know. Oh, here's another good one. Denies no pain. So he's in pain. So the patient's currently in pain. If they deny no pain, that means they're in pain. You going to do anything about it? Nope. Here's the thing with pain patients. This is your little lesson for the day. When a patient complains of pain, you have to get a full assessment. What makes it better? What makes it worse? How long have you had it? Can you describe it? When did it start? Give me a number. You need to know everything there is to know about it, because treating pain is super, super important in a hospital setting, in a long-term care setting, in home health, wherever you are. When someone says, oh, you have a really bad headache, and you say, here's some Tylenol, and they're having an intracranial bleed, you have now facilitated their death. When someone says, oh yeah, my back really hurts, like here's a muscle relaxer, but they have a rip and kidney infection, which ends up in septicemia, you have facilitated possibly their death. Get a really good pain assessment. And there's like 5 questions you have to answer. And then after you give medication, you have to reassess, did that make it any better? And if not, do something else. You're not gonna be like, oh, well, that's all the order said. You have to writhe in pain until the doctor writes something new. No, do something else. You can ice, you can elevate, you can heat, you can massage it, you can distract them. Do something, make it warmer in the room, make it cooler, change their position, find a way. What would you do if you were home and in pain? You would do something, right? Okay, here's another one. Oh gosh, I think I've said this before. This may have been written on another sheet, so I hope these aren't repetitive, but abdomen abnormally swollen, firm, and distended. No further assessment. That was just like in the middle of assessment. It just threw that in. Abnormally swollen, that's not, abdomens don't swell. That's not it's not a edematous thing. Firm and distended. I'm hoping this patient just had ascites and maybe one of their vital organs didn't explode and you're not doing anything about it. Let's hope that this is an ascites thing, in which case there's a better way to chart that, and we'll go through it. Not alert times 2. I don't know. That's all it says. Not oriented. So they're disoriented, I'm assuming. You're going to need a little more than that. Give a little explanation. Go back to my assessment video if you need it. Oriented sluggishly times 4. That's, I guess, my name and where I'm currently located and the date. Sluggishly. I don't know. Lungs labored. Yeah, lungs do they do labor. They work. Let's hope they work. Lungs labored. Uh, lower extremities resilient. That means she had some nice legs. Look at the pins on her. Her lower extremities are resilient. Nice. No. Right chest port KVO. You're missing some stuff there. It's maybe there's a right upper portacath with normal saline at 30 milliliters an hour. I'm assuming you want to maybe talk about the site, the dressing, anything. Nope. All right. IV left cubital. Is there a square somewhere that's cubed? It's probably antecubital. But here's a funny story. I can't spell, like not even a little bit. It's bad. My husband's forever making fun of me. I can't spell purse. I never know if it's an E or a U. I can never spell. I finally got hemorrhoid right. I finally got vacuum. Oh yes, did not know there was two U's in it until like recently. Yes, it's bad. Been spelling it with two C's. Thank God for autocorrect on my phone. Found out I've been spelling Afrin wrong. Decades I've been putting two F's in there, not. So I remember years and years ago, I hope some of you are watching, Sandy and I worked together and she decided, brilliant move, to tape up like two tongue blades together and we would put it on the chart to remind us when we need to put an antecubital IV in for a certain doctor who wanted an antecubital for an ACD. He didn't want it near the hand or the wrist, so they can pull the hands and wrists down to kind of open up the neck and get in there to do an anterior cervical discectomy. So I wrote it out, antecubital, as in like opposite of the cubital. And of course, Dr. Lenz found it. And he's like, that's an E, you idiot, not an I. So I will never spell that wrong again. But yeah, I'm not even going to make fun of you for not spelling, but leaving out a suffix or a word entirely, I'm going to make fun of you a little bit for that. Hearing deaf. Oh, maybe that's with the mute speech lady, huh? Speech mute, hearing deaf. Maybe it's Anne, what's her name? Helen Keller. Heart stint, and I get this all the time. I have heart stints. Did you do a stint in prison? It's a heart stent. A stent is opening things up. And patients often tell me they have stents. Like, yeah, I had a stent placed, or they put a stent in. Like, where? A stent is anything that you're opening a lumen to. It could be a vessel. It could be a ureter. You give me something. Where on your body was this stent? If they don't think it's a stent, then they never tell you where the stent was placed. And don't get me started with the whole prostrate. I get that every day. Someone will tell me, I'll take the Flomax for my prostrate. Does Flomax help you stand up straight? Because that's okay, I don't know. Urine from a colostomy. Yes, a student once told me the patient was getting urine from a colostomy. You think they meant urostomy? Let's hope. Or there's some wicked fistula somewhere we need to go hunt down. Pulse 4+ at rate of 84. I'm assuming that's a radial pulse, but all right, just a weird way to say it, but that's okay. Tissue palpates firm and hard. All right, now this leads you to believe A, the tissue is the one that's actually palpating, and that firm and hard, those are kind of the same thing, more or less, or interchangeable to an extent, but where on the part of the body, and should be the one palpating. The student or the nurse is the one palpating, not so much the tissue. Foley with adequate amount. That's my favorite. My Foley bag's got, that's about right. That's an adequate amount. It's you need to write down how much the Foley has in the bag when you're assessing it. And then you determine whether it's 30 milliliters per hour that you've gotten after it has been emptied the last time. Wound vac with no drainage noted. Okay, here's why this is wrong and not okay. If a wound vac is in place, its only job is to suction fluid from that wound so the tissues can meet and close up and heal and bind together, right? So it's kind of like if you have a wound that is filled with fluid, let's say it's filled with fluid to my thumbs, right? So let's say it's filled up that way. How can these tissues ever meet and close up, right? By secondary intention. If fluid is trapped in there, it's never going to meet. That's kind of what we used to do with packing, except everybody would jam pack it, and then those tissues are never going to meet because they're constantly packed. That's why you're supposed to measure it and put in less each time. So that vacuum is supposed to suck that fluid out, and that's why you get some quick healing. So if you have no drainage coming, you either A, don't need a wound vac, or B, it's leaking and it's not creating enough suction to fill the canister. So assess that. Okay, ooh, nails dry. I like that. Skin warm and dry, nails dry. Oh, that's a good thing. I'm glad the patient's nails are dry. I'm assuming you just painted them. Alert to person. That always reminds me of, what was that, Amy, what's her name from, is Amy Poehler from Saturday Night Live, who always did the who dat, and she'd like jump up and, you know, they were alert to person. That you're oriented to person. You're not like alert to who you are. That's weird. That sounds like maybe you're on meth. You're oriented to person, which means you know who you are. Okay, so I'm going to leave it there because, again, I have 100 things to do today, as always. And then all of this other fabulous stuff I will start next time. Looks like we got some good stuff. And I also have pages and pages of things patients have written down. And that is even more entertaining. So that's it. I feel like there was something else I was going to say. I don't know. Well, for the 6 of you still watching, appreciate you. Because it's been like one full year was the end of January. So I don't know how much longer I've got the patience to do this. I'll finish all the stuff I have here, which really literally could be months because I only do 15-minute videos once a week. So really it could be plenty. But I may go back and do a little CHF, diabetes, that sort of thing after this is all done. But let me know if you need anything, or if you got questions, or if you got any good stuff, you know, DM me, or you can put it in the comments here and I will put it on my next video. All right, so hugs and kisses, and I'll see you next time, if there is a next time. Same as always, face your fears, forget your failures, follow your faith. It's never gonna work. It's never gonna turn off. I think it's not close enough. It's almost touching. I think it should be over here. Huh? Over here? Nope, nothing stupid.